Hello juniors, so I welcome you all again in the continued series of upper limb and thorax, and today we are going to cover an important topic which is bronchopulmonary segments. And in today's module we'll be covering its introduction, features, segmental distribution, relation and clinical relevance. So without wasting further time, let's move ahead. So starting with its basic introduction, a bronchopulmonary segment is a portion of lung supplied by a specific segmental bronchus and its vessels. So basically our right lung is divided into three lobes, which is upper lobe, mid lobe and lower lobe, by two fissures which are horizontal and oblique fissures. So these lobes are further divided into segments which are known as bronchopulmonary segments, and each bronchopulmonary segment has its specific segmental bronchus and its vessels. So features, these are well-defined anatomic, functional and surgical sectors of the lungs. So these are the segments. Each one is aerated by a tertiary or segmental bronchus. This is our trachea, this is our bronchi, and these are tertiary or segmental bronchus, and each pulmonary segment is aerated by a segmental bronchus. Each segment is pyramidal in shape with its apex directed towards the root of the lung and base directed towards the periphery. What here he is saying is each segment, suppose this is our segment number 1, pyramidal in shape with its apex directed towards the root. So this is the root. Similarly, here we have another segment, its base directed towards the periphery and its apex towards the root. Similarly, here I have like this. Each segment has a segmental bronchus, segmental artery, autonomic nerves and lymph nodes. So here each segment has its own segmental bronchus. This is our segmental bronchus. Its artery, we'll be shortly covering its artery and its separate lymph nodes. Segmental venule lies in the connective tissue between the adjacent unit of bronchopulmonary segment. So these are the segment which I have told you right now. Its apex is directed towards the bronchus. Suppose this is a bronchus, here another bronchus. So these are the segments which are connected to each other, and each segment has its own arterial supply and segmental bronchus, bronchial artery and pulmonary venule. Here note that pulmonary vein lies in the intersegmental plane. Each segment does not have its own vein, rather it shares the vein like this. Here the pulmonary vein is shared between the two segments. Done with the features. Now segmental distribution. As I have told you, the right lung is divided into three lobes. This is our upper lobe, this is our mid lobe and this is our lower lobe, and each lobe is further divided into various segments. Now we will cover the segments one by one. So basically both lungs have 10 bronchopulmonary segments and we will cover them one by one. So this is our right lung. This is our right lung, and this is the medial view of right lung as we are viewing the root of lung. So if you haven't watched my video on root of lung, just go through it. And the medial view is we are viewing from right here. This is our point of view, and here the lung is divided into these segments. we will cover them one by one. And this is our lateral view, that is we are viewing from here. This is our lateral view, and these are the various segments of right lung. So bronchopulmonary segments of right lung, there are chiefly 10 bronchopulmonary segments, and those segments are in their relative lobes. So in upper lobe of right lung, in this lobe, the segments are apical, posterior and anterior segments. So in upper lobe I have this apical lobe, posterior lobe and anterior lobe. This is our upper lobe. In the middle lobe I have lateral and medial. So this is our middle lobe, and in the middle lobe I have the lateral bronchopulmonary segment and the medial segment. And in the lower lobe I have superior, medial basal, anterior basal, lateral basal and posterior basal. So in lower lobe I have superior, anterior, lateral, and two are in the posterior side, which are posterior basal and medial basal. And just to help you with these names, we have a special mnemonic, which is a palm seed makes another little palm. Here the highlighted letters represent the initials of each segment and can be remembered by this easy mnemonic. And to remember the lobes and their corresponding segments, we have the formula 3 plus 2 is equals to 5. Here 3 segments belong to upper lobe, 2 segments belong to middle lobe and 5 segments belong to lower lobe. So we are done with the bronchopulmonary segments of right lung. So done with the bronchopulmonary segments of right lung. Now we will be continuing with the left lung, and left lungs also have 10 segments, and these segments lies in their corresponding lobes, and which are upper lobe and lower lobe. So the upper lobe is further divided into upper division, which have apical, posterior and anterior segments, and lower division have superior lingular and inferior lingular segments. And in the lower lobe we have superior, medial basal, anterior basal, lateral basal and posterior basal, similar to right lung. And a short mnemonic to memorize all these names is: a pass is mandatory to all person, where the highlighted letters represent the initials of each segment. So here this is our lateral view of left lung. Here I have apico-posterior, which is apical and posterior segment, anterior segment, superior lingular, inferior lingular, superior and inferior lingular. So this is my upper division and this is my lower division. I hope you can appreciate with the help of these diagrams. And in the lower I have superior, medial basal, anterior basal. Here all superior, anterior, medial basal, lateral basal, and lastly I have posterior basal, which is visible from medial side. So done with the segmental distribution. Now the relations to pulmonary artery and relations to pulmonary vein. So pulmonary artery accompany bronchi. Artery lies in dorsolateral to bronchi, and each segment has its own arterial supply. We will cover this with the help of the same diagram. So here he is saying that our pulmonary artery, so this is our pulmonary artery, this accompanies the bronchi, this one is the bronchi, and the pulmonary artery lies dorsolateral to the bronchi, means lies backwards to the bronchi and laterally, and each segment has its own pulmonary arterial supply. So done with the pulmonary artery. Now relations with the pulmonary vein, that they do not accompany the bronchi, run an intersegmental plane, and each segment has more than one vein. So once again we are to this diagram. So each pulmonary venule, it does not, this is our pulmonary vein, so it does not accompany the bronchi. This is our bronchi, it does not accompany this bronchi, and it lies in intersegmental plane. What is this intersegmental plane? This plane connects the two bronchi or multiple bronchi with each other. So here in intersegmental plane lies our pulmonary vein, and with the help of this diagram you can also appreciate that each pulmonary vein is supplying more than one segment. This vein in 2D we are able to see that it already supplies the two segment, which is right here one segment and right here another segment. So also done with the relations of pulmonary vein, and lastly coming to the clinical relevance. So the knowledge of bronchopulmonary segment has led to enhancement in conservation lung surgery. Each segment is independent functional unit. As I have told you, each segment has its own artery, nerve supply and lymph nodes, but what they do not have is our pulmonary vein. This is a pulmonary vein, and each pulmonary vein supplies more than one segment. So localized chronic diseases like tuberculosis, bronchiectasis or benign neoplasm, if restricted to one segment, that one segment can be dissected out, leaving the surrounding tissue intact. So here, if this one segment got necrosed or is suffering from chronic disease like TB or bronchiectasis, and the surgeon decides to cut out this part of this segment, he can easily take out this segment, this disease segment, and can leave that surrounding tissue which is healthy, can leave that tissue intact, as this segment has its own arterial supply, own nerve supply, and this kind of surgery is known as segmental resection. So done with its introduction, features, segmental distribution, relation and clinical relevance. I hope you found this video helpful. If you found this video helpful, do like it and do share it with your friends. Thank you.